Hi, Amy. Welcome to NEXWEB podcast.
Hi, Srishti. Thank you for having me. It's wonderful to be a part of it.
Amy, can you share your background? How did you establish yourself in executive officer position in Ministry of Health Australia?
Thank you. That's very good questions. Talking about my background, I am, as you all know, my name is Amiee Karki. I am originally from Nepal, however, currently residing in Sydney, Australia. I migrated to Australia about 15 years ago. And I have a boy. I've got a 19 years old boy, one son, beautiful family life. That's my little background. Talking about my current profession, I'm currently working as a executive officer in Ministry of Health. Talking about how I established here, of course, it's not a easy journey. It was very difficult, but again, it depends on personal mindset, like whether you want to take this path as a difficult journey or, you want to take this path as a way of learning something. Um, I think for me personally, I must admit, I had a very positive mindset, and I have a habit of thinking strategic thinking practices. And I guess it's about the passion and commitment as well. So my very first paid role in Australia was the medical receptionist. As everybody being an international immigrant, I also didn't get the job for 9 months when I came here initially. And my very first paid role was the medical receptionist. And then um, after that, I never had to look back because, I was very committed with my passion. When I got my first job, I knew I'm going to achieve what I wanted to be. So at the time, I had a dream to work in a public services. And so 2009, I worked as a medical receptionist. Then by 2014, I already got into the hospital system, which is the government role. And then when I got into my first job into the hospital system, I already have another dream, which is I had a dream set saying I wanted to work into the Ministry of Health. That would be my ultimate dream. So then, working into the various different hospital on various different role. And from 2014 to 2022, here I am today. So about 7, 8 years for me to achieve that dream. So how I achieve is the questions. It's all about passion and commitment. It's all about continue learning. It's all about vision towards your goal, and it's all about how you take your career into the next level. It's all about working hard. I think you're working hard, working practices. You continue learning. We all know, life is about continue learning and practices. Like I do learn so much from my son, the high school kid. He teach me every day, and I do learn about some stranger walking on the street. When you talk about things, you learn something. So it's continue learning, having that mindset, positive mindset. It's is the key for me to achieve and establish where am I today. And I mean, like, I don't want to say I achieve everything. There's still a room. There's still a lot of opportunity for me to do even more. I am just a small employee in Ministry of Health. There are almost 5,000 employee there, and they all are high, health professionals. And it's all about we work collaboratively and have a good team there. That's all it is.
Amy, as an executive officer, what are your roles, responsibilities, and duties, and what sort of skills and qualification did you gain to work in Ministry of Health?
Well, talking about that challenges, I don't really have much experience working in a corporate world because my background is I just worked a couple of years as a medical receptionist. Then I got into the public health sector role. So I really want to talk about the challenges, though. The challenges of my role is, of course, it's complex regulations. The healthcare sector is highly regulated. It constantly changing policies, being up to date with that constant changing policies is and act upon are very tough. For example, just we can talk about the COVID. few years ago, COVID hit, and it's not just 1 month, 2 months, it's a few years, and still we are having some difficulties about the COVID, and still, due to the way the changes, we still have COVID patient admitted in the hospital. So, being up to date with that COVID policies, or being up to date with that COVID regulations, and response upon that, it's quite challenging. For example, when I receive an email about something, it's about regulations, about policy, then replying that, I had to think twice. Am I sending the right info? Am I aware of changing the policies? Am I being up to date? So complex regulation is one challenge as I found. The other challenges I found was interagency collaboration. The Ministry of Health frequently collaborates with other government agencies and international organizations. Coordinating efforts and aligning goals can be very challenging, and yet it's of course is crucial, and crucial for comprehensive healthcare initiatives. So in other words, I don't know how do I explain in a simple language. Collaboration in interagency is very challenging because it could change your job or everyday demand of your job very, very promptly. For example, if I am set for my day, okay, I'm going to do this job, I'm going to do that today, but then sometimes, there's this emergency coming up, all right, and then I have to act upon what are the emergency for that particular day, and I had to act upon the operational demand of that particular day. So that is quite challenging. So in other words, simply, the time frame we are given is very crucial. That's what I'm trying to say. And the other challenges I found, especially during the COVID, was, public health emergencies. My position, as well as, my colleague and my team's positions, is very crucial to respond to emergency health emergencies. To respond on emergency health services, such as pandemic, and, providing adequate resources, respond quickly and effectively. That's what it's called in health system. Act quickly, promptly, and effectively when there is a pandemic and when there is public health emergency, and prepared for that emergency. It's quite challenging. And of course, it's work-life balance. I'm very blessed that I am able to work from home. It's somehow I'm really enjoying that flexibility. But again, what my role demand is, like, for example, today's weekend and I was working in the morning. So if there is emergency, then I don't mind to open my laptop and work onto the weekend to technically where I am not liable to work on the weekend. But if my job demand, I do, and I don't mind. Being a health professional, you always need to be ready to act upon what are the emergencies coming, what is my roles and responsibility to act upon quickly. So that's kind of work-life balance things I found is a bit challenging. So yeah, these are the challenges. So not sure about how it worked, how the corporate world run, but public health is always tough. It's always challenges. It's always challenging. It's always what's it called? You're ready to act upon according to the everyday demand of your role.
What sort of differences have you found in the health system of developing country and developed country? I know like you have lots of knowledge regarding this. And are you personally satisfied with the health system of Australia?
Look, there is. I want to start from your last questions. Are you personally satisfied with the health system in Australia? I guess I don't want to say like I am 100% satisfied. There's always not like that. There's always on any particular area, any particular policy we write, any particular regulations we have, there's always areas to improvement. We come along with we come along and then we come along and learn so much from as we practice this, as we experience. So there's always area to improve. We can even take the references from different other different developed country too. So I am happy what we have here compared to my background coming from the underdeveloped or developing country. I'm very happy with the services we received here. However, there's always area to improve. And talking about what are the difference, between developed and underdeveloping countries, what are the health system differences about? develop and other developing countries. I think the first look, I am not. Just want to make sure I'm not an expert on the area. My answer would be best on lucky. You asked me the similar questions. When I was doing my master's in public health a few years back, I think 4 or 5 years ago, this was one of my part of the assignment. So I had a bit of I've done a bit of a research a few years ago. So my answer will be best on that. So I also want to clarify, I am not an expert on the area. So my answer would be best on the research I've done not long ago. I think the first thing, the differences I found was infrastructure and resources. You know, the developed country, they have well-developed healthcare infrastructure with modern hospitals, advanced medical equipment, and, you know, talking about the high number of healthcare professionals as well. And whereas developing country, you know, they often face, you know, lack of resources, shortage of healthcare facilities, outdated equipment. I think I faced that personally when I was in Nepal or any other developing country. That's the first thing I found. The second thing I found once I came to Australia, what is more important and what's the difference is access to care. So I don't know if people understand in everyday languages, we're talking about what's access to care is, you know. So developed country, generally they have better health access. That include primary care or specialized services. I mean, I'm talking about the specialist treatments and even emergency care, you know, emergency facilities. And the developing country may struggle with limited access. So access to care is how quickly you get that access. That's what I'm trying to talk. You know, for example, if you go to the developing country, even my own country, back home, how prompt you get that access of care. You go to public hospital, how long do you have to wait? You know, that kind of things. And also the third thing, the differences I found was the quality of care, you know. So based on my experience there, when I've been to the hospital here, it's I can see they tend to provide higher quality healthcare services, and within the strict regulations and quality control measures too here. And of course, Australia included Canada, I guess, you know, they are very advanced in medical research and innovations. You know, they're doing all this research in trying finding about the cancer medications, for example. You know, lots of fund has been spent doing the research about the cancer treatment. And whereas the developing country, you know, they have variation in the standard of healthcare service delivery. So the other thing I found also is public versus private healthcare facilities. Most of the developed country now have mixed kind of healthcare system, which is public and private. Like, for example, America, Australia, you know, we encourage people to have private health alongside with the public health services facilities they have. The government have provided to the public, whereas, you know, the developing country may have limited private health options, or, you know, that leading to have disparities in quality and access. So I think it's lack of financial support from the government and lack of your own, talking about the affordability as well. You know, it's less people tend to have private health insurance in developing country, I guess. And the other thing I really want to add here, I found into when we had COVID pandemic as well, the developed country are better prepared for pandemics preparedness, you know, awareness, and, you know, talking about, like, for example, access to vaccines, talking about the global health crisis, whereas developing country are less prepared for the pandemic awareness, pandemic preparedness. I would say, you know, access to vaccines and treatment. We can give an example of COVID. Not long ago, we had that pandemic, and, you know, the vaccination access was readily available for the developed country, whereas developing country had to wait, or, you know, had to wait for the financial support from the developing country. I mean, developed country. So these are the differences I found. Primarily, I would say, you know, infrastructure, lack of resources, access to care, how promptly you get that access, that kind of things are the differences. These are the, you know, these are the point I picked few years ago when I was doing my assignments. There may be more. I mean, I still need to read a lot of articles. I guess I still need to do a bit of more research. But as I said, I'm not an expert, and my view towards this is completely personal.
I mean, in Australia, although a permanent resident or citizen is given free access to healthcare, which is Medicare, but also they are growing the private health insurance. Like, why is it?
Yeah, that's also a very good question. Thanks, Srishti. And also, again, I want to clarify this. Again, I'm not an expert on the area. My response would be based on my own experience. Like not long ago, I personally renewed my private health insurance. So I am a citizen in Australia. So the question is why I wanted to have private health insurance, even though I am a citizen and I have a Medicare. So just talk about just based on the Australian private health, how does it operate? The Australian private health system operate alongside with the public health system. That means alongside with Medicare, you know, talking about why people should have public health insurance. Number one, I guess it's choice of healthcare providers. So in other words, private health insurance allow individual to choose their preferred healthcare providers. What that mean is if you've got Medicare only, but and the other person's got Medicare and private health insurance, that person can have broader range of the health service facilities he can get. If you got private, you can go to private. You don't have to wait in public. I don't know a lot of people are aware or not. For example, in Australia, the public health system have they have categorized the waiting period of elective surgeries. For example, if your surgery is clinically urgent, they put you on category like 30 days waiting time period. If not that urgent clinically point of view, they put you on the 60 days category. And then if it's not so urgent, they put you on 90 days category or even 1 year category. So are you ready to wait? Just have a Medicare, are you ready to wait that long? Aren't you worried about your health? That's where the question arises. And but if the other hand, if you have private health insurance, then you don't have to wait. You go to next day to the private health, private hospital and have your elective surgery done. So that's the different. You have a broader range of choice of healthcare providers when you have private. That's the one thing. And the other thing I found is reduced wait time. I already talked about, how our public health system function. Like we've got a waiting period associated with elective surgery. So question arises, are you ready to wait that long? Or do you want to do your surgery next day? So when you have private health insurance, in other words, it reduces the waiting period. You have a choice to have your treatment done next day. So that's the other facilities you can get when you have private health. The other thing I wanted to add is access to private hospital. Of course, I already talked about that. When you have private health insurance, you are comfortable to personalize your healthcare experience. So you can go to private, you can have your choice of your bed as your own, and you can have your treatment done whenever you want to. That's wonderful, I guess. And the other thing I think I wanted to add, I don't know people how famous in our community is having a private health insurance. I'm not sure, but when you have private health insurance, choice of treatment and services it's wider. So what's that mean is private health insurance often cover a broader range of treatment and services than the public system. That cover include services like dental. Like I don't know, a lot of people may not know where Medicare doesn't cover your dental. Optical, private health cover that. Optical and like for example the physiotherapy, that kind of additional services. When you have private health, you can have those additional services for free, or maybe there are some gap amount, not sure, depending on who are your service provider. And I really want to add this. I guess in our community, or even in Australia, apart from our community, the other communities too, a lot of people may not be aware there is a government incentives if you want to take private health insurance. There is a government rebate that government is giving for someone who want to take private health insurance. For example, if your family income is 186K, or below, you get up to 24% rebate from the government. What's that mean is you'll pay, government will pay 24% of your total annual fee of your private health, and you're only liable to pay 76%. So, and also, when you've got private health insurance, you don't have to pay Medicare surcharge. When you got higher income bracket, when you are in a higher income bracket, income family holder, you may easily pay few $1,000s easily onto Medicare surcharge. But when you got private health, you don't need to pay Medicare surcharge. So having said that, I'm not trying to promote the business of private health insurance. I really want to confirm that I'm not associated with them, but I'm just talking about my own personal view and my own personal experience. So I have private health insurance, and I've got Medicare as well. The reason I do that is, I get extra facilities, I get extra benefits, and I can save some on tax too, because I don't have to pay Medicare surcharge. And having a peace of mind as well, when you got private health insurance, just peace of mind, that you can have access on timely manner for all in case of unexpected health issues. So these are the benefits I found personally. And as I said, there is government rebate as well if people are not aware. And also the other little part of what I wanted to add is I just came to know not long ago, and I really want to share too, is if you don't have private health insurance when you are 31 years old and over, when you're 31 and over, and suddenly you decided when you're 40, you decided you want to have private health insurance, then the government allow private health insurance service provider to charge additional 2% of each year. That means each year from 31 to 40, it's 9 years. So you'll be charged 18% more than the normal people who have private health insurance when they are 31 years old and over. So they will pay less, 18% less than you. So in other words, you will eventually pay more when you decided to have private health insurance later on your lifetime. So I guess personally, if I need to give my own view, it's if it's that within your capacity, within your affordability, it's better to have to get more services, to have more better health access, to be a peace of mind, to be in peace of mind. It's better to have private health insurance alongside with the Medicaid.
I mean, like when a person is migrated to Australia in different visa, like he have a private health insurance,
Yeah.
but after certain years, he become a permanent residence or citizenship by various reasons. And can he continue with that same private health insurance? And is there any benefit?
Look, I don't want to say he can continue with the same service provider. If he can afford, or she can afford, yes, absolutely. As I said before, there are hundreds of different benefits, so many benefits. He can or she can continue, absolutely, but I don't really want to recommend, yes, he can or he can continue with the same service provider, because in this competitive world, there's always room to search which is the better one. We always compare now. Like me personally, I always compare, and I do change my private health service provider every year. Last year I was with someone else. This year I went with someone else. So whoever give you for the same facilities, whoever give you on better price, reasonable price, it's better to look around and continue to have private health insurance. But again, talking about, is that person really can afford? That's the other questions. So yeah, it's just calculate your expenses, calculate your rebate from the government that you're getting, what percentage you're getting. So just bear in mind, the government rebate, as I told before, it's not 24% for everybody. It depends on your family income, or even if you're single, it depends on your single income, how much you earn, and based on that, government will give you some people they give you 24, some people they give you 16%, some people just give 8%, so depending on how much you earn. So if someone can afford, it's always better to have. And I would really suggest to look around who is the better service provider and who's got reasonable price. So always good to have that continue of the services. Yeah.
Amy, what sort of solution you want to give to those migrants who have qualification, but because of lack of skills and confidence, they are not being able to sell themselves in white collar job?
Thanks, Christy. I think this is very common issues in our community at the moment. I can see there are accounting professional, there are IT professional, and I can see the numbers are really low. they're working on a similar field. I guess it's gradually improving though. So I found why it's lack of confident, lack of having a good communication skills. And I think confident and communication skills are correlated things. For example, if someone cannot communicate well, cannot be able to convey what you're trying to say, then you lost your confidence. And when you lost your confidence, you hesitate to express yourself. You hesitate to be expressive. That's first thing I found. This is no offense. These are totally based on my own personal experience. I had an opportunity prior to the ministry. I had an opportunity to work closely with our HR team, where I used to lead and I used to assist the recruitment process of senior medical officer manager. That means a lot of people don't know about this role, I guess. What that means is I used to assist and lead to hire the doctors, national and international. So what I found when I was in the panel, what I found was, primarily the lack of good communication skills are the obstacles for them to be able to sell in this market. So what I want to suggest to the newcomers is, as soon as you finish the uni, or when you know you're about to finish your uni, seek for the mentorship program, where there are a lot of mentorship program where they teach you how to build a resume, how to be professional, how to act upon, this kind of bridging course, I guess. These are being when you finish when you're the fresher, just finish the uni, and trying to set yourself, try and put your feet onto the market. There's kind of bridging course you need to look into. I would suggest before you even finish your uni, you should start looking onto those. And there are a few other courses you can do, or even if you've got a platform you can practice, for example, language and skill development courses. So that's definitely help you to enhance your employability and integration into the Australian society. I've done that once I finished my accounting degree here. I've attended professional, it's called the professional course, of course, and which helped me to get to know how the practical world function. Once I finished my degree, I was into the practical area, like I was into the real job area for 3 months, practicing how should I function, that kind of things. And then third is, of course, networking. I really want to encourage them to attend networking events, social gatherings, expand their professional and social circles. And the further one, it's maybe not important, but it's better it's better to have that cultural understanding. So we promote cultural understanding and adaptation. Adaptations is equally important when you are when you are thinking, I go to Australia, I wanted to stay there. I probably don't want to even come back, or I probably want to stay my whole life there. Then it's better to have cultural adaptation. So that includes language as well. So I really want to predominantly tell, first thing is language. To be able to sell yourself in this market is the English language. I mean, whatever language if you are in different country, don't speak English or some other language, then adapt that language, adapt that culture. It's equally important as well. That doesn't mean I'm trying to say, oh yeah, you forget your own cultural heritage. I'm not trying to say, but get the good things of every culture. I think that's me personally. So no offense, everyone might have a different perception towards it, but it's good to have that kind of adaptation into the country wherever you're living. So predominantly, as I said before, language, skill development, networking, a mentorship program, and prepare yourself to be able to sell in the market as soon as you finish the uni. Before you finish, even you plan before you finish the university. This is what I want to suggest them. Yeah.
Wow, thanks, Amiee, for lots of helpful tips for migrant, and wish you have a successful career in your field. Thank you so much for attending the podcast. Thank you so much.
Thanks, Christy. It's wonderful chatting with you guys, and thank you for having me and giving me this opportunity to be able to share my views. Thank you.
Thank you, Amiee. Bye.